Thank you, Jack. Understood. Thank you for stopping by and participating as time allows. Enjoy your family. I'm here at my daughter's house without family, just dog sitting. They're coming back from the Georgia mountains today. I've been watching dogs for a week and house sitting as well. Enjoy your company. I do have PY2BBQ checked in as well. Are there any other early check-ins for the Metaclimate Radio Council digital voice back? If so, make your call now. We are approaching the top of the hour here. This is Alfalfa 4 Foxtrot Lima. I think we've reached that time for the net to start. Good afternoon, good morning, good evening, depending upon where you are here. We've got coverage from Moscow to New Orleans right now, and plenty up on the East Coast as well in Brazil. Welcome to the Marco DV Net. This is AA4FLJ. I'm your net control for this session. The purpose of the Marco Digital Voice Net is to provide a discussion forum for current medical events and issues. We will all present in a roundtable format. That all stations are welcome to participate, whether you're a Marco member or not. Drop one. We have 7 early check-ins. We have AA4FL, KD4IZ Jack, N5RTF Jack, WA1EXA Mark, N3IM Keith, WD9GET Keith from Moscow, PY2BBQ Hilton from Brazil. We'll have more check-ins here in just a minute after a little bit of housekeeping. The directed net working from a login list. As I mentioned, anyone can join in on the conversation, but please check in so we can get you on the roundtable list for discussion. Drop one. The net meets every Saturday at 1500 UTC through link repeaters. And realize when you're transmitting, pause before you transmit after the last transmission so you don't tailgate and come after someone. But give the repeaters a chance to synchronize and reset themselves. Since we're coming in many different formats, some on repeaters, some coming from DV sticks, etc., etc. We do have NetLogger up and running. We have check-ins going. If you want to bring NetLogger up, there's a chat window within NetLogger. Drop one. And while all stations are encouraged to participate, whether you're a Marco member or not, one advantage of being a Marco member is we often have topics for the net that are distributed on our Google group, and anyone's allowed to join Marco and encouraged to join Marco. We're a group of individuals that are in health fields, but we're also a group of individuals that are interested in health fields. So regular members versus associate members, everyone is welcome to be a member. And of course, many of the talking points for today are related to COVID. Are there any stations that have emergency or priority traffic for the net? If so, please make your call now. Okay, none heard. I'm looking at the instant message feature on NetLogger and seeing we have a few more individuals that will be checking in. But before we resume regular check-ins, I know we have a few members that are going to be limited in time. KD4 IZ, WD9GET. Are there any other check-ins that are limited in time? Go ahead and make your call now.
This is N4TSC. Got limited time this morning. Back to you, Jay.
K3FZT will need to secure from the net at 15:45 hours UTC, 11:45 local time. Thank you, Jay. K3FZT, back to net.
Thank you, Jerry, and thank you, Steve, and we'll make sure to get going on our first round of discussions. And I don't think we'll have any trouble within 45 minutes getting through round one, but if it looks like it's getting short on time, I'll move you guys up the list. WJ8B, are you here with us too? Go ahead.
Yes, good morning. I'll be able to stay until at least 12 o'clock Eastern time, I believe. So when you have trouble getting that WDV working, his login with a handheld, I got that WDV working. There was a bug in it I had to fix. So back to you, Jay. I'm WJ8B.
Great to have you here with us today, Andrew. I've got you all checked in. I'm glad you got the technical aspects addressed. The WJ8B is checked in. Now, up to 10 check-ins. Are there any other stations that would like to do a regular check-in now at this time? Please go ahead and make your call. This is AA4FL Net Control. Okay, no additional check-ins heard. I do have the discussion thread that was distributed on the Google group, so I assume that most of you, if not all of you, have that in front of you. Is there anyone that does not have the list of talking points who would like me to repeat them? Go ahead and make your call.
Well, I'm entirely comfortable acknowledging my ignorance and pleading for enlightenment. K3FZT.
Okay, this is AA4FL, and I'm looking for enlightenment myself. We had a series of talking points that were based on current events for the week. But also we had an email from one of our members in India who I don't know if Sursenda is going to be here with us today because of the time difference, VU3WTJ. But he did mention that in India they were expecting another wave of Delta variant starting the last week of September, and they were building their capability in anticipation of that wave. So one of our concerns right now here was, are we going to continue to have the issues that we're seeing now in the U.S.? And we'll go ahead and start with that discussion and anything else that was on our list, which, considering the children coming back to school, we think that's discussable as to whether that's going to contribute to another wave here. Let's go ahead and let Jerry for TSC take the mic first. Go ahead, Jerry.
Okay, very good, Jay. Thank you very much. Although I don't have the full agenda at the top of my thought processes at the moment, I have noted that there's been a mix in the U.S. of differentiation of the political versus the medical judgments associated with the COVID-19. And I think one of the risks that we have to start looking at and be very wary of is that the Delta mutation may not be the only one that we have to deal with. We have to be aware and be very diligent to pick up on other variations because the 50% of the U.S. public that has not been vaccinated puts us at risk to see some of these new variations that may come along, and it may create further problems. Also, with the breakthrough in Israel, it does look like we don't have a full defense against even the Delta variation at the moment, although the level of illness has not been entirely life-threatening. I don't know that there are any cases of people who have been double vaccinated with the mRNA version of the vaccine have succumbed to it. But there is that risk, and any information that we have is just anecdotal. So those are some of the points that I would like to hear. And although I may not be able to continue with the net for very much longer this morning, I will follow the recorded version and review what's been reported. With that, let me turn it back to you, Jay, and for GSE.
Thank you for the contribution here, Jerry. I do have a question for you, and I don't know if data coming out of Israel can answer this question if you're familiar with it. But with children going back to school, not being vaccinated, if they are a reservoir of infection, spreading infection, do we know anything about the levels within the nostrils of the Delta variant in terms of communicability for distributing it back when they get home after they've been exposed from fellow children? I know some of these schools or systems are not requiring masks by state mandate. So it's complicated. What do you know about that, Jerry?
Okay, thank you for the question, Jay. I don't have any hard evidence on it, but I do know that we now have many, many examples of young children who are succumbing to this virus, and there have been deaths reported as young as 5 years old, even in the U.S., based on this. And I think it is foolish for us to continue to leave these children unmasked. At the very least, we ought to develop the principle of what we call in medicine wearing a belt and suspenders. We need to protect against the transmission of this disease, and we know that even the young are a reservoir and can, in theory, be carriers, even though they may not succumb to this disease, and they may then transmit it to even other unvaccinated people and families and so on. So I think it's foolish for us to abandon all of the resources that we have to try to mitigate against this disease. Back to you, Jay.
Okay, it looks like Steve shared a nice link about breakthrough infections. If you have the AIM, if one has the NetLogger instant message feature, feel free to follow Steve's link that he provided. So, Jerry, one other question for you or for us as a group to ponder, since you and I may not be privy to the answer, but you hear so many things in the mass media, you try to read between the lines. So there's coming out the data in Israel, I guess it was like, I don't remember the exact percentage, a quarter to a third of people susceptible to breakthrough, not necessarily symptomatic breakthrough. But the question is, if those people have breakthrough infections, whether they be symptomatic or not, what is their communicability or the viral load for transmitting that? Have you heard anything about that, Jerry?
Negative, Jay. I have no hard data on that at the moment, but if I'm able to ferret out some information, I'll share it with you in the next meeting. Over.
Okay, thank you very much. Now, Steve, K3FZT, thank you for sharing. I haven't had a chance to look at this article yet, but maybe Richard posted something. It's a good read. It may have information about these questions. Let me turn the mic over to you. This is AA4FL. This is the Medical Amateur Radio Council Digital Voice Net. We're going to turn the mic over to K3FZT, Stephen in Philadelphia.
AA4FL and the group. This is K3FZT, Steve, West Mount Airy, Philadelphia. So the link I put up is a really nice article written for the intelligent layperson. It is not a medical article. It is journalism, not peer-reviewed research. With that caveat, I nonetheless found it quite sensible, and I have shared it widely in my circles, and I'm getting a lot of positive feedback. The master point here, and what I hope folks would take away from it, is that vaccination is a public health measure. It is not individual health care. Let me say that again. It is a public health measure, not individual health care. And indeed, I have yet to put the link up, but I will shortly put the link up from the New Statesman, which is a UK publication, which shows how the UK's COVID-19 vaccine rollout has dramatically reduced deaths. And there's a really compelling graph there. So we should not kid ourselves that the vaccine prevents disease in individuals. Wait one. The vaccine does prevent disease in individuals to a degree, but its purpose is to prevent deaths and serious illness in the population at large so that the healthcare system is not overwhelmed and can continue to care for ill individuals who require that care. I can put up a third link, which means I will owe you two, from NPR reporting on a serious outbreak in Provincetown, Massachusetts, which, as many, perhaps all of you know, is commonly considered a gay mecca, and during the summer is a common vacation point for gay communities and gay-led families. And people dance in clubs and bars, tightly packed at night, in swimming pools during the day that are crowded. And they've had a huge outbreak out of Provincetown of the Delta variant. Wait one. So let me conclude this round by pointing out that there will be more disease, and you and I may, in fact, become ill because of infection with the Delta variant or the Epsilon variant, yet to be identified, or other subsequent variants, as Jerry has pointed out. But the public health appears to be protected to this point. Thanks for the opportunity to speak, Jay. Let me turn this back to you, AA4FL, and the group. This is K3FZT.
Thank you very much, Stephen, for contributing that thought. It's been interesting seeing the current events, and I don't just mean it in a scientific standpoint, but in the public policy or application, being that it's a responsibility more of public health to get vaccinated. But the NFL yesterday, some of the reports that I read, they were considering or were implementing punishing teams that have COVID outbreaks due to unvaccinated staff by forfeiting their games. So they're attaching a personal responsibility to the teams in the NFL, which is significant if a game has to be canceled due to an outbreak. So it just opens up a Pandora's box of possible actions that are ethical or unethical. Things like if an individual does not get vaccinated but yet becomes a burden to society through hospital expenses, will they be personally responsible for the hospital expenses since it was to a high degree preventable? So it's just another question to ponder. I don't know the ethical nature of that in terms of medical ethics, but it seems a parallel discussion to the one for the NFL problem. I'm not sure if Jack is available, KD4IZ right now, but Jack's wife is a pediatric infectious disease specialist, and Jack may be privy to some of those answers that some of the questions we're asking about viral load in children, if they're going to be able to spread the Delta variant when they come back home, even if they're asymptomatic, since it seems to be much more concentrated in other variants and potentially more easily communicable. Jack, are you available today to discuss this topic now? Go ahead. Okay, yeah, well, Jack mentioned he was short-term and in and out. Jeff, you're next on the list. We have 5 RTF down in Orleans, and there's been plenty of nice media coverage of what's going on in the New Orleans area, but why don't you pick up and explain some of the issues that you're having down in Louisiana? Go ahead.
This is M5 RTF. I was listening to the discussion about Provincetown. We're also a tourist destination, for lots of different groups from all over the world. And that's how we got COVID earlier than just about anybody. And then we had a long, successful decline, and now it looks like it's coming back again. And it's coming back because of unvaccinated people. I was amazed to find out that 40% of my fellow employees at Ochsner Hospital have not yet been vaccinated. And of course, some of them are young, but they're working around sick people every single day and taking it home to family and friends. And wait one. I'm a fan of Scott Adams. I listen to his podcast several times a week, and he's the guy that draws Dilbert. But his other love is persuasion, and the podcast is about persuasion. And he made the suggestion that all we need to do to get people vaccinated is publish, instead of one figure every day, number of deaths from COVID, publish two figures, number of vaccinated deaths and number of unvaccinated deaths, and let people just wear themselves down looking at the disparity between those two numbers. N5RTF, over.
Thank you for the input, Jeff. But, I mean, where are we now nationwide on the number of deaths per day?
Well, last week in New Orleans, Louisiana, it was like 3, but I don't know what it is now. I can look it up in between when the next person comes up. I'll look that up and see where we are. But the number of cases has definitely gone up. The number of hospitalizations has definitely gone up. I do think deaths are still low because the high-risk people have all been vaccinated. N5RTF.
Okay. This is AA4FL for ID, Medical Amateur Radio Council, Digital VoiceNet. Jeff, that's what I was wondering, because if deaths are 400, albeit 0 from people that are vaccinated, 400 from people that are unvaccinated, and you publish that information, nationwide, it's going to be, there's only 400 deaths. And that may actually be counterproductive in persuasion because the figure is still low. Let's wait one on that thought. And are there any other individuals that are listening? Again, you encourage everyone to check in, even if you're not a Marco member. So you can ask questions and be part of the roundtable discussion. So if there's any late check-ins, let's take this opportunity right now to hear from you. Go ahead and make your call.
Whiskey 3 Hotel Delta Bravo.
Comment.
Whiskey 3 Hotel Delta Bravo, thank you for checking in. I'm glad to have you here. We're going to put you at the list here and get you in the queue for discussions. K3FCT, Steve, are you at the point where you need to leave, or did you have some additional comments to make right now? Go ahead.
I'd like to disagree that deaths are the only number to report. Here's one sentence from the Provincetown report. The 14-day average number of cases per 100,000 in the town rose from 0 on June 30 to 13.8 on July 14th, and as of yesterday was at 176 cases per 100,000. My editorial comment is we have no idea how people are affected by COVID. Up to 55% of long COVID and cardiovascular COVID and other kinds of COVID may persist after acute illness. We just don't know. So deaths alone are not an adequate measure.
Okay, this is Net Control AA4FL. Thank you for the additional statistics. From a standpoint of persuasion and the public perception, those statistics and statistics in general that mean a lot to us, understanding what exponential growth would be, although here we're not necessarily going to be looking at exponential growth with 40% unvaccinated. But to the layperson, they don't understand how quickly the disease can spread, and they're going to find out too late. They haven't had a vaccine and they need 2 doses, so kind of problematic all around. Changing the line of thought here, because we're talking about Provincetown and Orleans has been tourist destinations that are frequently populated from individuals all over the country. We've had a long summer of children that have been on vacation. Mine were just up in the Georgia mountains. I've been up in Tennessee. And here you've got all these children under the age of 13 that have no vaccinations going back to school. So are they a reservoir, a petri dish, since none of them are vaccinated, to bring the disease home, spread it amongst each others, and then reinfect that 40% of the population? Because that, if that was true, Provincetown and Orleans would pale in comparison to the potential effect of that. We're going to move on next to the list here to WA1EXA. Go ahead, Mark.
WA1EXA. Well, I can give you some statistics. I'm in the same county as Provincetown, Barnstable County. And there is some interesting statistics that I'm questioning, but are kind of crazy. While Barnstable County, which includes Provincetown, has a rate of 16 cases per 100,000, the vaccinated rate for Barnstable County is 69%. That's fully vaccinated. The other two counties that are in make up Cape Cod, which is Nantucket and Duke, have Duke's has 86% fully vaccinated, and Nantucket 84% fully vaccinated. Wait one. Now, as far as hospitalization goes, Barnstable County is real low. We have 2 per 100,000. Well, that is an increase of 115%, but it's still a very low number. So we have 2 per 100,000, and all of those. It doesn't tell me they came from Providence, but Provincetown. I'm sorry, but it could have, that's included in that. We have 2 hospitals on the Cape, one being the main hospital, and they would take the bulk of that. As far as deaths go, Barnstable has 0.7 as the average daily deaths. Over all Massachusetts is 3.7. So again, or in the case of per 100,000, it's 0.31. For Massachusetts, it's 0.05. And as far as vaccinations go, I think I told you that. Yes, I did. So there are other things also is that people over 65 in Massachusetts is 97% have at least 1 dose, and fully vaccinated is 87%, all ages being 72% and 63%. So that really comes down to the vaccinations are very high in Massachusetts. Wait one. Some things that are going on, local establishments are starting to mandate vaccination verification. They're starting in Boston and also in Provincetown. And also Provincetown has changed as far as its demographics somewhat over the past few years, where it was primarily a gay community. It is now turning into a family community. Some of those families, of course, are gay families, but it is not the mecca that it used to be. The problem there is the geographic area. Wait one. If anybody has ever looked at the map of Cape Cod, the Provincetown is the very last town on the Cape, and is very small in area. So everybody's kind of crowded together. Main Street, which is Commercial Street, is unpassable in the summertime. They close it to traffic, and it's still unpassable with as far as people. So everyone's crowded. There is no large venues. All the venues are very small, and therefore are very crowded. The population increases 3 times in the summertime as compared to the winter, which you would expect, because in winter once they go to Provincetown. So there is, and that's been normal. That's normally what they get. They're used to it. That's what they expect, and that's what the economy runs on basically there. And also that I understand, and this is from the local press on a medical. It's not a medical fact, but from what I've heard is that the majority of the cases that are being found are the Delta variant from Provincetown. The local hospital here has been tracking that for a while now, and that seems to be the case. One. So while other places that do have a high population increase during the summer suffer from the same type of problems, Provincetown has that added problem of being in a very small area that has nowhere to go. It's surrounded by water on 3 sides, and the only town that is next to it, which is Truro, really does not have any venues. It's a small town. The majority of the land in Truro and the next town, which is Eastham, Wellfleet, is mainly the National Seashore. So there's very little population and not that many places for people to stay. So they all congregate in Provincetown and don't have any place to go. Other than that, they go down Cape where I live. I live down in the town of Yarmouth, which is just down at the beginning of the Cape. It takes about an hour and a half to 2 hours to drive from the beginning of the Cape to Provincetown. So it's about 35, 40 miles to the end of the Cape in Provincetown. Those are some basics that we have going on right now here on the Cape. Yes, indeed, we're aware of it. It's leaving new cases for Massachusetts, which is primarily very low, but it has very high vaccination rates. Although a lot of people are coming in as visitors, they are primarily coming in from the Northeast, which are typically high vaccination rate states. So, back to you. If anybody's got any specific questions, I'll be happy to answer them. WA1EXA.
Well, thank you, Mark. WA1EXA, AA4FL Net Control for the Medical Amateur Radio Council. Thank you for filling us in on the local variations and some of the considerations. I'm familiar with the Cape, of course. My parents were both Bostonians, even though I'm a native Floridian. And they actually met on Cape Cod. My dad was a musician, and my mom met him and fell in love with the guy in the band. I'm going to turn it over in just a minute here. Next on the list to Keith. Before I do Keith, Keith has a little bit of a different perspective from his general area. The challenges are probably a little bit different in more of a rural setting. But going back to the persuasion question, it would seem that for young people, morbidity, certainly a list or figures of how many people have gotten into trouble in what age groups might be more persuasive than the mortality at this point. But at some point, the mortality will be. And going back to the verification, in Florida, that's prohibited by the governor. So in a lot of states, it is. So the employers can mandate, I believe, vaccinations. well, for young people, that might be the best way to get them to comply. So, but you've got the White House, which is even requiring their own employees to be vaccinated, just encouraging it. So, we talk about politics, but it shows you on both ends of the spectrum, there's still not necessarily consistency in that approach. Jocelyn? So, Keith, N3IM, tell us a little bit about the challenges within your area, both from a physical nature and from a management nature, the outlook of the local population towards these challenges at hand, and what's the preferred way of reducing the virus. Go ahead, Keith, N3IM. Go ahead.
Yeah, this is N3IM in the group. Well, Pennsylvania has the third lowest rate of coronavirus, particularly the Delta variant, as it surges nationwide. We're averaging 10.2 cases per 100,000 residents per week, and that's mostly occurring in the population dense areas such as Philadelphia, Pittsburgh, Wilkes-Barre, Scranton area. In the rural areas, we're wide open, and we're not really seeing a significant increase in COVID in our county. All the stores have it so that if you've been vaccinated, you don't need to wear a mask, and if you haven't been vaccinated, please wear a mask. They don't demand you wear a mask. They can't even ask you if you've been vaccinated because of HIPAA violations. We've had our first pediatric death reported this week, and that was an 18-year-old. Pennsylvania considers the pediatric population to be 0 to 18. Break one. They're not giving out much information on that. They're not saying whether he had any comorbidities that could have created his situation or not. Speaking of ages, the greatest deaths have always occurred in the about 55 and up age group in Pennsylvania. That's very, very true. And that we see mostly the 70 and 80 and 90-year-olds succumbing to COVID. And the comorbidities obviously are interesting because you would expect the immunocompromised, the organ transplants, and people like that to have more death rate, but the comorbidities are more along the lines of dementia, hypertension, diabetes, COPD, coronary artery disease, chronic kidney disease, and congestive heart failure. So that's an interesting thing with this COVID. But here in this rural area of Pennsylvania, we're not seeing a significant increase in COVID-related illnesses or significant illnesses, and the pediatric population is doing quite well here. So this is N3IM, back to the net.
AA on net control for the Medical Image Radio Compliment. Thank you, Keith. I'm glad you're doing well there. It's nice to hear success stories. I wish it was uniform here. South seems to be bearing a lot of the burden here due to the high numbers that are not vaccinated. We have a few check-ins here, WJ8B and W3HTV. I haven't had a chance to get up to make a presentation, so I want to just check in with WD9GET first here in Moscow and see if it's a time where you can participate. I know your time limited. Go ahead. Okay, nothing heard from Keith in Moscow. Also, PY2BBQ, who records for us, I'm not sure if you're doing your YouTube presentation and have extension today if you're tied up and busy, but are you available, Holton? Go ahead.
Okay, for FL and the group, this is PY2BBQ Hilton from São Paulo, Brazil. Thanks for the opportunity and a very interesting discussions today regarding the variants of COVID-19. You know that the Delta strain, we have found them in Brazil also. More than 100 patients have already been identified with this kind of COVID, but it's certainly not the prevalent form here in Brazil. We still have as prevalent COVID the P1 or the Gamma strain that was originated in the Amazon. It's still the prevalent here. And what we have seen in the last weeks was as have already mentioned in the last week, was a decrease in the number of deaths and the number of new cases as well, and especially the number of hospitalized patients and intensive care unit occupation. So it seems that the vaccine is really working, as Stephen said, and I agree absolutely. Vaccination is public health care and not an individual choice. And I think it's easier for the population to understand this point in countries where the health care is a public health care, because there is a common sense of responsibility on health, public health. You see, as an example, here in Brazil, it's motorcycle riders. It's mandatory to use the helmet. It's in the law. So wait one. When there is a motorcycle accident and brain injury, we all are going to pay for that treatment. So it's fair that in the law, the motorcycle rider is obliged to use a helmet. And I think the same happens when we have such a crisis like the pandemics of coronavirus. And I'm really in favor of mandatory vaccination. Of course, you cannot oblige someone to get vaccinated, but you can say you need the vaccine for this or for that, for documentation and so. Well, that's a point of discussion, but I'm in favor of that, especially because the whole people pay for the treatment of those who have not been vaccinated. That's something to think about. Well, here we had more than half of the adult population already vaccinated. It's about 100 million people have already received the first doses. Brazil is in the third place among the countries that have already given more vaccines. First place is India, second place United States, and third is Brazil. Of course, if you think of the proportion of the population that have already been vaccinated, it's not ideal, because it's more than 200 million people, but it's giving good results. Just another quick comment. I have worked for as a military doctor in São Paulo State Military Police, and we have about 90,000 military policemen in São Paulo State, and considering the retired policemen, it goes up to 1,500,000 people. So we have one hospital with about 100 beds and 10 beds for intensive care. It needed quickly to be updated to 30 beds of intensive care. Wait one. And the police force in São Paulo State was prioritized to receive the vaccine. So the whole community, the whole number of policemen, military policemen in São Paulo State have already received the 2 doses of the vaccine. And this week, for the first time, and in our military hospital, we didn't have one single patient with COVID-19 in the hospital. So I think the most important marker is the number of deaths and the number of patients needing intensive care or with severe COVID-19. Unfortunately, the vaccines that we have don't have 100% of efficacy. So we won't achieve what we saw with the polio, that the virus disappeared. We won't see that with the COVID-19, and unfortunately, we'll have to keep people being vaccinated probably in an yearly basis. So that's the story. Thanks for the opportunity, and back to you, JA, 4FL, PY2, BBQ.
Okay, thank you, Joseph, and thanks again for recording the YouTube session and offering the perspective from Brazil. I do have a couple of questions to ponder. I don't want to an immediate response, but just a comment. First one on the Brazilian side is that if the Gamma or the Amazonian variant is still the prevalent variant in Brazil, whereas here in the United States, I think the Delta variant was up to about 83% and being almost omnipresent. That would suggest that some research needs to be done into why the Amazonian version is having a natural ability to not be affected to exceed and survive where the Delta variant does not. Because statistically, the Delta variant should have intruded much more if it had the ability to do so, or some kind of advantage over the Amazonian variety in terms of infectiousness. The other comment just here on the state side is that I know the economy has been a factor, and they're trying to find the best balance and in the public health sphere as well as the economic sphere. I mean, the health and welfare of the individual to thrive and survive both physically and financially, but is there still a hidden agenda or a march to herd immunity through infection on the remaining peoples? Is that a desirable thing to consider versus really encouraging everybody to get vaccinated? Now, I can go ahead and move down the list. We have two WJ8B and W3HTB that I had a chance to make any comments. Andrew, go ahead, WJ8B. Please go ahead and make your presentation.
Well, good morning, everybody. That's we're a little bit late getting on here. Been listening to excellent articles that Steve posted through about 1.5 of them already. So, very, very good information. Good information I can share with many of my well-educated friends who are not medical-oriented. As far as Ohio, the rate had increased. It's been primarily the Delta. Yet the governor of Ohio has been pretty good with COVID, is not changing the mask. He's taken away the mask requirement. He's not changing anything on the school thing as well. And he still plan to open schools without masks just a few weeks away from now. So yeah, it makes me wonder some. On a personal note, I was a little tired this week, and the reason I was tired was my wife and I had to go get our daughter early evening flight coming back from Los Angeles, and visiting my youngest son. And turned around, they were over an hour late, and the reason they were over an hour late is some passengers refused to put the mask on. So Southwest Airlines and their knowledge says, well, that won't do you any good. We're going to take you back to LA. They did that. They apparently escorted them out of the airport and said, you're not welcome back. So that fixed them, but it means it meant my wife and I had to spend another hour and a half waiting for them to show up on the break. A question about children having the virus that kind of hit home as well. I have 6 grandchildren. The 2 older ones who are fully vaccinated went to visit 2 younger ones who are not fully vaccinated. And it turns out, the day before they were supposed to get there, they found out that the little ones had been exposed. It turns out they didn't come positive, that they were exposed at it's not really a daycare, it's a pod that they've been attending ever since COVID started, and 2 of the members of that pod that showed positive for the Delta variant. They only got mildly ill with it, and there were no complications with me so far, but it is obvious that it can still be spread, and those of us that are vaccinated may still get it and spread it to other people as well who are not vaccinated. Break one more time.
Well, thank you very much, Andrew. It's always a pleasure having you here. You always offer excellent input. Thank you very much for being part of our discussions. I'm Daniel, W3HDB. Why don't you tell us a little bit about yourself, and then feel free to ask any questions or make comments that you might have. We're glad to have you here with us. Go ahead. Okay, W3HDB, currently not receiving anything from you, so I don't know if you stepped away here. I know it's been a long time since you checked in, and we were glad to get you on the list here, but didn't know if you were short term or not. And if you are available and within earshot here, and you'd like to go ahead and make a presentation, ask a question, we'll go ahead and give that opportunity again before we move back up to the top of the list and come back to you. Go ahead. Okay, well, hopefully you'll be checking back. We'll give you another opportunity. Jack, KD4IZ, if it's a time when you can can participate. I know you were short term with a lot of company, but having the wife of the infectious pediatric infectious disease specialist, some of the discussions we've been having here, we certainly use and value your and her and Susie's input. Go ahead. Okay, perhaps Jack's not available. Chet, you had the mic quite a while ago, and there's been a lot of comments made since. Did you have some follow-up comments or connections between what's going on local and some of the other topics that we discussed? Go ahead and make your call, Chet.
Yeah, this is N5RTF. I looked up some information. There's not as much on Louisiana. They did say that 97% of the deaths since February have been unvaccinated persons. I did find numbers for Texas, which is right next door. Since February, 8,787 people have died from COVID, and only 43 were vaccinated. So you're looking at 99.5% of deaths are in unvaccinated individuals. And I respect your what you said about young people not really looking at the mortality. But there's got to be some way to present this. When we took the polio vaccine, we weren't worried about febrile illness. We were worried about crutches and iron lungs for the rest of our lives. So maybe emphasizing long haul symptoms might be a way to get people's attention. Over.
Might very well be, Chip. I'm just wondering on the podcast if there's a mechanism for you to communicate that opinion from the Medical Layman's Radio Council. Over.
I actually have had a couple of patients who had COVID encephalopathy. One in particular took about 6 months to get back to her previous level of function. Others are proceeding at differential rates. Seem to leave people, 5, 10, 15% shy, at least for several months after they have the infection. N5RTF.
Thank you, Jeff. We appreciate you looking up the statistic for us. I imagine Mississippi, if their statistics are available, also in Alabama, of course, have had their challenges. And I guess all of us in the South here, we all have certain areas of our states that are a little more recalcitrant than others. And you had mentioned before in Louisiana some of the other local factors involving the perceptions of the church, etc. in the past. WA1EXA, Mark, do you have any follow-up comments? Go ahead.
EXA. A couple. Comment was made about asking people if they have been vaccinated. At least in the state of Massachusetts, it's a common practice. I happen to be a docent at a museum here, and that is a common question that we ask if they are not vaccinated, and some aren't. We mandate they wear a mask. If they are, they don't have to. And it's not considered a HIPAA violation. I don't think it was ever tested in the courts or anything, but that's basically common practice. And as far as the masking of the children going back to school, here they start in about a month, and everything is a local decision when it comes to schools here. There is no widespread school districts. It's a town-by-town decision. And that is exactly what is happening. There are some towns that are mandating masking, some towns that haven't made a decision yet, some towns that decided they're not going to mandate it, but it is a town-by-town thing. The universities, all of the higher education here, all that I know of, have mandated that returning students will need to be show vaccination or get vaccinated, depending on the case where they're coming from, before they can attend class or be in the dormitories. And that's in this whole state of Massachusetts. We have a lot of universities, a lot of colleges. So that's the state of affairs here. Back to you. You may win the exit.
People. Is there anyone else that would like to make some follow-up comments or questions about the topic for today before we close the net? Go ahead and let me know, and we'll start a list for that. Go ahead, this is AA for us.
Comment, WAWNXA. Did you get my comments?
To the net.
Not on this last go-around, Mark. I hear you now. Hopefully I'm not having technical difficulties. Go ahead.
Okay, quickly, I'll say we do not have a problem with HIPAA laws, at least at this point. We ask everybody coming into our facilities whether they're vaccinated or not, and mandate they put a mask on if they're not. School systems are town by town here. There is no, well, there are some, but very few regional type of districts. So every town has their own regulations as far as the masking. And some towns have already mandated for kids going back next month. All universities I'm aware of, and there's quite a few, are mandating that all returning students have to have vaccinations or proof of in order to be in the dorms or to attend classes. So that's pretty much these things here.
And thank you, Mark. I asked that question of some of my fellow faculty at the university. We haven't really heard exactly what's going to be required, but the University of Florida will see. Of course, it's probably a little different from school here in Florida, and they may be prohibited by the governor for doing so. Any other individuals like to make comments? Go ahead. Well, thank you for everyone being here today for the Medical Image Radio Council TV Net. It was a lively discussion, covered a lot of topics. Feel free to follow up on the conversation through the Google group. Most people are set up in digest mode. They're going to get one compiled email a day. You're not going to be spamming people by asking questions. I encourage you to, knowing that that's our most accessible means of communication. WVU3WTJ asked me for the DMR information for the QuadNet. So if you are a Marco member and monitoring the QuadNet frequencies, listen for Sir Sendhu. He'd like to chat with physicians and medical people here stateside. He's a captain in the Indian Army who happens to be an oromaxillofacial surgeon and has been addressing COVID patients and stuff. 7-3, everyone. Have a wonderful week. Be healthy. May your families and friends be healthy. And may we all be part of the solution and not part of the problem. This is AA for us. I'll until next week. Thanks. 7-3, returning the frequency back to the QuadNet array. Our gracious host, to be very generous, allowing use of the technology. AA for us. All clear.